Once again, I want to show you these live pictures of the House. The debate continues on the GOP health care bill. A couple of moments ago, I mentioned that was Elijah Cummings from Maryland that was speaking. It was actually John Lewis from Georgia. Looks like I need my health care for my vision to continue, as many Americans, of course, do. This is one of the most momentous things we've seen happen in Washington, the repeal and replace of Obamacare, if it passes. So as the bill stands right now, should it be passed? I want to bring in Evan Siegfried, the author of GOP GPS, and Lanhee Chen from the Hoover Institution. He served as a healthcare policy director on the Romney campaign. And gentlemen, welcome to both of you. And Evan, I have to ask you first, the big question here is if they don't have the votes. President Trump said last night, this is it. He's done. We're moving on. Do we have the votes?
I think we're about 2 votes either way at this point.
That close, you think?
It's very close. By my informal whip count, I've got 27 Republicans voting no and about 30 on the fence. And that's not where you want to be with less than an hour until a vote on this bill. So what Republicans are trying to figure out, it's the conservative Republicans, the Freedom Caucus, who are remaining true to their principles. They want full repeal. They don't like this. You're trading one mandate for another. And at the same time, you've got more moderate Republicans who are saying, well, I'm not a big fan of shifting the costs to the states and absolving the government of the problem and saying it's all in your back.
But it all ends up, Lanhee, about being compromised at the end of the day. I mean, even President Trump ended up compromising when it came to interstate competition between insurance companies. That seems to be, coming later in the last, version of this bill that we've all read. But it seems to me that this is a short-term fix, and then there's a longer-term plan. Isn't that better than not addressing the issues with Obamacare that would indeed eventually implode the system?
I think we're at a point where the choice is relatively binary. It's the status quo and Obamacare versus this vehicle, which, look, no one says is perfect. I certainly think there are things about it that could be improved. But there are many things about this bill that make it worthwhile of support. The reform, for example, of the Medicaid program, which will, if left unchecked, bankrupt the federal government and, frankly, take many states with it. So the notion that we're having fundamental reform of that we're trying to get some reform of the insurance markets, not as much as everyone would like on the conservative side of the aisle, but some reform nonetheless. I think there are good steps in this bill forward, and frankly, the alternative at this point is to allow Obamacare and the status quo to continue, and that, I think, is unacceptable.
Let's look at this and just kind of go through and give our viewers, again, because, unless you follow the exact TikTok that's happening out of Washington, especially in the last 24 hours, you're not sure what this bill is anymore. If you look at it, so as it stands right now, what's being debated, it eliminates Obamacare fines and subsidies, many are applauding that, even the moderates, a 30% penalty for lapsed coverage. I want to get your take on that one, Evan. And then tax credits based on age, not income, a sliding scale, if you will. But the 30% penalty, some say that is too harsh, Evan.
It is a little harsh. I think that the penalty really isn't that enforceable either, because it's a 30% penalty paid to the insurance companies themselves, not to the government. And I think that there is no incentive. If you say, I'm not going to have coverage, there's no incentive to really go and get coverage because you're going to be paying more as a result of that. I think there are other things. Lanhee described this as far from perfect, and that's true, but it's a big dumpster fire of a bill, and because it was not really well thought out. It didn't include the president's key signatures that he campaigned on, such as eliminating state lines to promote the free market and competition.
That's something I've been saying for years on our air. I feel like
and the president has married himself to this. Additionally, there's the Hippocratic Oath, which says do no harm. This bill actually harms many of the people President Trump is trying to help, such as in Appalachia, where there's an opioid epidemic. This allows...
That came back in, though. But that $15 billion that they agreed to last night,
that's $15 billion, but this still allows for the insurance companies to impose caps on coverage. And if you have a drug addiction, which the NIH lists as a mental illness, an insurance company can say, we're just tired of paying for your therapy, and then pull the plug on that. That doesn't help things at all.
I don't know, Lanhee, what do you make about that, the opioid issue? Because that certainly came into play, because a lot of these congressmen from this particular, there's some in the New York area that said, I cannot go back to my home district and say that opioid addiction funding is gone, and that made them a no. What do you say to that?
Yeah, I mean, look, this bill, first of all, on the lifetime limits and caps, I think a lot of that architecture from Obamacare will remain, and I think that's frankly why some conservatives are upset about this, is they'd like to see more of that architecture taken away. There's a question of whether you can do that through this budget reconciliation process that Republicans are pursuing. But separately, on the opioid crisis, I would hope that's something where Republicans and Democrats can work together, quite frankly, to bring out some legislation that will help states in particular that have been hard hit, New Hampshire, Ohio, two electorally important states that have had huge problems with the opioid crisis. So, look, the reality is this. This is what President Trump and Republicans in the Congress have described as the first step of a multi-step process. I know people are skeptical about the processes as they go forward, but there are some things here hopefully they can get Democratic support for and move on, like interstate purchase of health insurance, like the opioid crisis.
All right. Well, Evan and Lanhee, thank you very much. There's so many machinations of this bill, certainly as we follow the changes and now the debate is on. Guys, thank you very much. Appreciate it.